How can I help?
It's actually about my weight.
Okay.
So I've been struggling with my weight ever since I can remember. I go to therapy for it, all sorts of things. I've been doing really well with it the last few years. I mean, the heaviest that I got was sort of 32 stone. Then sort of a year and a half ago, I went down to about 20, just under 20 stone. And that was just sort of changes to diet and gym and all that kind of stuff. And then I got gout for the first time in my life, which was no fun at all. And it just completely threw my routine out. And I got back on track about a month ago. So I'm going back to the gym, everything, you know, I can feel my clothes getting looser and all that kind of stuff. So I feel like I'm back on track. But I was wondering if there's anything sort of medical that can kind of help along with that as well.
Sure.
I remember back when I was a teenager, I was given something called Xenical.
Okay. The way it works is by not allowing the fat that you eat to be absorbed, essentially, so it comes out in the stools, so it can make your stools a little looser and sometimes can develop diarrhea and things like that, so just as a warning. Generally with that, we need to prove that it's working for it to be justified in prescribing. So we need to see a 5% weight loss after 12 weeks. If after 12 weeks you've got 5% weight loss, then we can continue it. So as long as you've got kind of commitment to weight loss, that's great.
Definitely.
And I think, you know, the way you've told me about how you've been trying this, you know, you've been doing exercises, all this kind of stuff, I feel like you are trying, and that's great with me. So I can certainly prescribe it, but I do need you to come back because you do need to kind of be monitored as well.
I just thought something that would help me along, kind of, you know, if I see results quicker, I tend to just sort of stick with it more and all that kind of stuff. Every little help.
Absolutely. Well, I have sent both of those over to the pharmacy that you've tablet.
Awesome. Will they be ready straight away?
It should be, hopefully.
That's
all
great.
Right.
Thanks a lot, Dawson.
You're really welcome. Take care.
It.
Bye.
Hello.
Put the kettle on.
Yeah.
Wait a sec, what are you having for lunch?
I don't know yet. What is that really happening?
Yeah, I bet you do know.
I know.
Yeah.
Okay, she's seeing a patient, so I can't interrupt her. So I can get her to give you a call back.
Hi, how are you?
I'm well. How are you?
Fine, thank you. Come through. Good to see you. Take a seat. So you had your bloods done, didn't you, for the health check?
I did.
Okay. So the bloods for the NHS health check are your sugar level was normal, 36. It should be under 44. Kidney function was all completely normal. Liver function, again, normal. And cholesterol was fine as well. So all good. Okay, so any questions about the blood?
No, that's normal. That's good.
Yes. Can I get your blood pressure, please?
I like your eyebrows.
Thank you.
Are they all yours?
90%.
Oh.
I'm getting slightly over the top of them, I think, but
No, I think
that's the look I like.
Nice shape, no.
Okay, so that's.
So over my BMI, you have to measure me though as well, don't you?
You've got your height.
You know, I've been shrinking over the years, rather a lot.
Really?
When I was pregnant, they made me 5'1¼ inch. Last time I came here, what was it, 4'10" or something?
150 centimetres.
Have you got a measuring thing?
Yes, I do.
See what
Did you want to be measured?
Yes. See, I can't have shrunk anymore. 4'9", that's really, really short. I'm trying to be my tallest.
Got you just under, actually.
You're kidding. Are you serious?
Yeah, 149 and a bit.
That is terrible. That means I'm really, really shrinking.
It's what happens as you get older. It's not going to make that much of a difference to your cardiovascular disease risk, so let's get that score.
It does to my pride.
Oh. All right, so I can give you your cardiovascular disease risk score now,
Yes.
which is in a percentage form, and anything over 20% is at risk. Yours is 6.5, so you're not at risk.
But what about with the BMI bit of it?
8 kilos is what they suggest you. But that's not, I wouldn't really dwell on that.
I was 8 stone at one time.
Yeah.
And when I was ill, I was
Lay
less.
off the Lurpak.
No, I'm just about to go and buy some more.
There you go, can't win. Okay, there we go.
Okay.
Nice to see you. Take care.
Darren speaking, how can I help?
So I can see that 3 results have come back and they all say normal, no action.
All right, then the doctor will give you a call this morning.
Yeah, Candy. Daisy. And how are you today?
I'm alright, but I still got a cold.
Still got?
A cold going on.
Okay.
It's never ending, it seems. Since the last time I seen you, so the lump things are still there. There's no shift in size, but they're still there.
Okay. And we did lots of investigations for those.
Yeah.
And all those investigations are normal and reassuring, and it's not unusual to feel lymph nodes down in the groin.
No, there's just loads of them. My mum thinks it'd be better if I get another blood test. Maybe, I don't even know what she was trying to say anyway. She was just being a mum, I guess.
Yeah, because she's concerned because of what she's been diagnosed with in the past, isn't she?
Yeah.
Your mum's also very sort of anxious about it. Because with her lymphoma, it took a long time to diagnose, didn't it?
Yeah, I believe so. I think she just had one said lump for a long time that then got bad. That's why I'm worried, because I've got about like 10, no, not 10, but like more than I could count on one hand, I reckon. Okay. And it's a bit worrying, for me at least.
Theo's a young man who I've seen on a number of occasions who is extremely concerned about palpable lymph nodes that he can feel around the body. And his anxiety around this is heightened because his mother had lymphoma and that diagnosis took a long time to reach. I'm just worried that one day it's going to get bigger and then it's just going to be for crying out loud, like, everything's gone tits up, really.
So we better get a urine sample, ideally a midstream sample, so let the first bit go down the loo, it's the next bit we want to try and catch in the pot, come straight back and we'll do your blood pressure, okay?
Can I ask you to nip next door to the bathroom and try and do a urine sample for me?
Yes. You've got some blood in the urine. Are you around your period at the moment?
No, not really. Do you think you'll be able to do a sample? I can try. Do you want to try? Yeah? Okay. Give it a go. And you know where the bathrooms are? Yeah.
I do.
Hi there. Hi, I'm Dr. Watson. Hi, you come. Nice to meet you. Hi, Poppy. It's good to. This is Dr. Dillon, who's a new registrar sitting in today. Hi. Nice to meet you. Hi.
How you doing?
A little nervous. Before you just described yourself as.
Yes.
Right. So you just joined the surgery, it looks like.
Yes, we just joined the surgery, and I think I might be pregnant.
Okay.
So I've got a urine sample.
Okay.
I had the Mirena coil, and I got that taken out, I think, on the 17th.
Okay, so you got pregnant very quickly.
Yes.
Yes.
We weren't quite expecting it
Quite
to be so quick.
And you've done a pregnancy test?
I've done three pregnancy tests, but Nick wouldn't believe it until a doctor says it.
Okay.
But still...
This might come as bad news, but we don't actually repeat them here because the tests we have are exactly the same as ones you have at the chemist. And if you've got 3 positive tests and your period's late, you are absolutely definitely pregnant.
So what happens now?
So what happens now, I'll give you some information. We can check your blood pressure and your weight, and you can have a think. There's no rush for things. You've got plenty of time. You're coming nice and early. But you might want to think about which hospital you want to go to for your antenatal care. So they then send you an appointment for your scan, which is normally at 12 weeks' time, and then also an appointment to meet with the midwife. Okay. And that's your booking appointment. You'll have a blood test taken then. Not very much happens in the first trimester, basically, when you're, and I don't know how you're feeling at the moment, if you feel fine. Yeah. And things like smoking and alcohol.
No, I don't smoke. Well, I do drink, but I don't. Not much. Yeah, I haven't been drinking.
Okay, brilliant. Anything you want to ask of us?
I don't know.
No.
I'll give you this, which is Emma's diary, which is quite a nice little week-by-week account of what to expect.
Okay. Thank you very much.
Great, that's fine, yes. All right, okay, congratulations again. Okay, bye.
Yeah. Oh, no. She's inactive. So you had to re-register. You okay?
Thanks for looking after me.
Oh, that's all right. Anytime, my darling, anytime.
Right, how can we help you?
I was in A&E last night because I had severe abdominal pain.
Yeah.
So I checked my urine and they said I had lots of blood in my urine. I'm not on my period at the moment, and and they didn't think it was appendicitis, but they think it could be kidney stones.
Yeah.
We're going away on a week tomorrow, so I'm a bit worried that, you know, if I go to Spain with something like that, that's why I'm here.
Yeah, let me just sort of confirm their findings, if I may. So
Yeah.
if you can get a urine sample today, and I'll feel your tummy as well.
Right.
And then we'll talk about the investigations. I mean, what we do is we need a scan, but we also need some blood tests as well. Kidney stones are tiny little stones which form in the renal tract. So that's the tubes from the kidneys down to the bladder and then out the other end. And the big thing about them is that they really hurt and they're really unpleasant to have. So patients tend to present with very severe pain. Classically, they find it extremely painful, writhe around on the bed, find it very difficult to get comfortable. Quite often they find they might be vomiting or feeling sick with it, and just generally very unpleasant. And it tends to not be the kind of thing you can take a few paracetamol for and it sorts itself out. I'll get you to grab a seat. I'll just test this and we'll go from there. Importantly, there's no signs of infection in there.
Right, okay.
Most stones are very small and they tend to pass on their own and settle down, which is probably what's going on with you.
Do they always pass, or can they?
No, they don't always pass.
Yeah.
There's never always in medicine, and there's never. My proviso really is if the pain comes back and gets worse, I think it is a go down to A&E kind of job.
So I guess the danger is just that if a stone gets stuck somewhere, that you then what would happen? Would I get a temperature, or what?
It could do if it gets infected, or it could affect the kidneys. But the blood test.
But it would be painful, innit?
And no, very painful.
Yeah. Okay.
So I'll give you the blood test form. I'll also refer to the urologists. Stones which are less than 5 millimetres or half a centimetre will spontaneously pass in the majority of cases. If, on the other hand, the stone is bigger than 5 millimetres, they don't tend to pass. And there is a range of procedures from ultrasound shockwave treatment to operations to actually go and get the stones out, or even open surgery. It all depends where it is and how big the stone is.
Cheers, bye.
Take care, see you.
Yeah, we're gonna ask.
When they were asking like, oh, when have you got an appointment like on this day? How did you see it so fast? Like,
So used to it.
Oh my god!
It's because you trust me. I used to be like that as well.
I'm like, what are you looking at?
Yeah.
I've seen like one slot.
Yeah, do you know what? I used to be like that. Like,
when we called the master, and they were like, if they're there for longer than like 2 months, you should, like, that's not really normal. They've been there for like 3, the one in my neck for like almost a year. Or it's just a bit weird, because I don't think any of my friends have got them.
When I saw you last, we went through quite a lot of things with the lymph nodes, didn't we? When you spoke to Dr. Chana, and there was a sort of a question about an ultrasound scan, which was something that we didn't arrange, did we?
On my groin. Nah, we didn't. I didn't do that. But I thought it'd be a bit weird. It's a woman not touching my groin and that.
I don't know. We don't know who's going to be holding the ultrasound probe. It could be a man or a woman.
Yeah, I went last time. It was a woman.
Okay.
When she done my neck.
In Theo's case, we have done a range of blood tests looking at the full blood count in particular to see if there was any additional reason to be concerned. And in the past, we have done ultrasounds of a number of his nodes, and they're always reported as normal. I think it's a really difficult situation because there's a concern from you, and there's a concern from Mum as well, with what's happened to her.
Yeah.
And I wonder whether or not, if we spoke to one of the haematology doctors, that might be more reassuring for everybody.
What does that mean? What is a is that?
That's one of the doctors that deals with lymph nodes.
Right.
Okay.
Yeah, maybe that would be a shout.
Yeah.
It's just subconsciously I'm quite anxious about it. So I'm constantly checking it.
I completely understand that. You know, and I understand sort of Mum's sort of worry around things as well. Let me have a talk with a haematologist.
All right.
And then I'll get back to you on the phone.
So there's nothing urgent. No.
I wouldn't rush to do any more blood tests or anything like that.
Okay.
So you can tell Mum that at the moment.
All
right. And then we'll go from there, and I'll give you a call when I get that opportunity. Okay. Take care. Take care.
I had loads of questions. I was just sitting upstairs going through right, what am I going to ask?
I can't believe you can actually read as well. You're so cute. always ask. It's better to ask than to get it wrong, because once you get it wrong, you're in trouble.
Duncan. Hello, come on in. Come and have a seat.
Thank you.
Hi, I'm Dr. Beecroft. It doesn't look like we've met before.
No. No, I tend to.
You keep well away from us by the looks of things.
Ah.
What are we up to today?
I'm a bit bothered about prostate.
Yeah. Do you have any symptoms? Are you having problems with your waterworks?
One I've had for 30 years, which is I get up to pee at night maybe 3 times.
3 times,
And I would,
okay.
I mean, I'd love to have a full night's sleep,
Yeah.
but I don't think that's possible. So that would have been my target at one time. So that's my only external
And
thing.
that's been the case for a while, so it's not
Yes.
suddenly increased. You just
No.
have always been someone that's been getting up regularly at
Yes,
night.
yes.
Okay. And what about during the day?
I probably pee about 9 times altogether.
Okay.
At one time I got it down to 6 pees a day.
And in terms of kind of when you do go, any problems with your flow, or is it stopping and starting?
I'm not as young as I was, so it I don't get a stonker of a pee anymore.
Sure.
But it's not bad. But at night time I'm putting out maybe a cupful.
Okay. And any accidents?
No.
So I was just looking at your notes. So you did have a PSA, the blood test, done kind of May last year, which was nice and normal. And has anybody ever referred you off to see anybody about this at all? You've not seen a specialist?
No.
And medication-wise, you're not taking anything?
That's correct.
That's pretty good. Okay, fine. The other thing I was going to say, any change in your weight recently?
A little bit lighter.
Okay. Unexpectedly lighter?
I vary between about 10 stone 4 and 10 stone 7.
So what are you now, 10-4?
I think so.
Yeah. I think we should do some investigations and see what's going on. We know that prostate problems happen as men get older.
Yes.
And if, and it's very, very common. And if we were to kind of do a post-mortem on every man when they died, we would find that a huge number of them actually had some form of prostate cancer, but has never really troubled them. So I think it is worth us investigating to check that. But it's reassuring that your symptoms haven't particularly changed and gotten any worse, and that you had a blood test last year that's normal. But I'm also always a little bit suspicious of people who lose weight without really trying. So to start with, what I'd like you to do is go and have some blood tests done, which we can get done here at the surgery, and then a few days later come back and see me and we'll go through the results, and then depending on what they show, we'll kind of take it from there. Okay.
Thanks, Dr. Beecroft.
No
That's
problem.
just great.
Great. Okay, so I'll see you probably in a few weeks' time.
Yes. Fantastic.
Okay, take care.
Thank you.
Bye.
And yourself. Bye now.
I've got a quick question. Up to what time can you keep putting people on that callback list?
Officially till 6:30, because obviously because usually when they ask for a call and that implies they might need an appointment.
Okay.
Yeah, not bad. Come and have a seat. Hello. Hello.
Sorry that we're late.
Don't worry, don't worry.
I was trying to get back from Chelsea and Westminster.
Right, Harry.
Are you allowed the toys? It looks like they've taken out all the toys, Pickle.
Oh no, not a good
Why
room,
don't
I'm
you girls
afraid.
go back in that waiting room and play with the toys there, okay? I'll be right back. Just go and read a book. Okay, love you too, bye. Right. Because the baby's coming soon, I wanted to discuss antidepressants and if we should talk about it or what we should do.
Yes. When are you due?
I'm 39 weeks on Friday.
Right. Okay. So you might deliver at any moment.
Yes.
Right. Antidepressants, what are you doing at the moment in terms of...
So nothing since I found out I was pregnant.
Yeah.
So just not sure how to manage it with the baby, so due any day now, and so just not sure how to approach it. If I should immediately try and go back on, if I should wait till I finish breastfeeding, blah blah blah.
Right. How's your mood been during the pregnancy?
Middling to low.
Right. Okay.
So I've sometimes found it a struggle. I suppose partially because when I first came off the medication, obviously that was very hard. But I see sort of various triggers on my horizon that are making me nervous.
Right. Not, I wouldn't say engaged yet.
We have a bottom spine, head down here.
This time I'm having an epidural, and no one is talking me out of it.
Any problems with swelling of the ankles or any swelling
No,
anywhere?
nothing to report. I just feel stretched and susceptible to farting. But I'm fine, absolutely fine.
When you said earlier that your mood during this pregnancy has been kind of middling to low, what's that been like when you felt low?
Well, I think, yeah, it's been a real struggle. Sometimes, sometimes it was very difficult. Sort of a combination of feeling very overwhelmed by life in general, combined with feelings of, just hopelessness.
It's now thought that being depressed during pregnancy could potentially even be more common than being depressed postnatally. Some estimates state that between 10 and 15% of women are depressed during pregnancy, whereas it's generally accepted that 10% of women experience postnatal depression. How has your mood been after your other deliveries?
Well, I had quite severe P&D with the first one. And then I would say more managed P&D with the third.
Right.
And nothing with the second.
And what did we do after the third? Did you have antidepressants then?
I did, and I had a counsellor.
What are your plans in terms of breastfeeding?
With my last one, I breastfed basically 9 or 10 months.
So you would be keen to do that again?
I would, yeah.
If possible?
If I can.
The balance between risks and benefits of treatment with antidepressants is shifted in pregnancy and breastfeeding. And that's because the baby will be exposed to those medications. The risk is higher in pregnancy than it is in breastfeeding. In breastfeeding, there are some medications, including some antidepressants, which are to be avoided, but there are others that are considered generally completely safe.
So in terms of antidepressants, there are versions of tablets similar to the ones that you were on before, which I think are safe in breastfeeding.
Okay.
I'm going to ask the perinatal mental health consultant that question,
Okay.
and then I'll get back to you and we'll decide what to do.
Will you give me a ring or?
I will call you. Okay. If you haven't heard, within a week or so, you should ring me back.
Okay.
Good luck with the delivery.
Thanks. Okay, thanks, bye.
Like, you guys go so fast when you're doing stuff, and I'm like, I'm not going to be able to go that
Yeah,
fast.
we weren't that fast before.
she's looking for like an appointment, and she just knows all the availability, and I'm there thinking, I've seen like one slot.
Hi, Nicola. Hi, come on in. See, turns out to be prepped. Looks like you're new to the surgery, is that right? Yeah. Okay. Right, what are we up to today?
I've had a cold for about 3 weeks now, and I feel like I'm over the worst of it, but I seem to be really, really, really just so lethargic over the past few months, and I don't know whether I'm like run down or anything, and perhaps that's why it's sort of like prolonged, and it's not so much the cold, it's just the kind of like the sheer tiredness. I feel like I lead quite a regular active life. Like I work out, I eat quite healthily, but I just can't seem to shake the constant tiredness and just feeling just quite exhausted a lot of the time. And I'm not quite sure what to do.
Right. So, apart from just feeling tired, anything else that you've noticed that's a bit different or changed at all?
Like my skin's flared up quite a bit. It feels
The difference,
quite, yeah.
And diet-wise, any particular things that you don't eat in your diet? Or
I don't really eat a lot of bread.
Okay.
And I do notice if I do eat it, it's not very pleasant the next day or following day.
So just lean forward for me. What about things like pasta?
I don't eat that.
You don't eat that?
No.
And is that for the same kind of reasons?
Yeah.
Yep. Okay, so just open your mouth nice and wide for me. Say it's quite difficult working out. Is it just that life is really busy and hectic and actually you're trying to, although it doesn't feel like you're doing particularly excessive amounts, is it actually
just a bit too much?
Too much? Or actually is there something else that's going on? The basic place to start is just by getting some blood tests done to check, are you anemic? Is there a problem with your thyroid gland? The thing that's kind of interesting from what you've said is that you've naturally just excluded certain foods from your diet.
Yeah.
Because you kind of notice that it upsets your stomach if you have things like that. That makes me question it a little bit, I think, particularly in the context of you feeling tired, as to whether you might have something called celiac disease, which is where your body can't process gluten in your diet. Lots of people have similar symptoms, so they kind of feel, actually, I just feel a lot better if I don't eat this kind of stuff. And they don't have celiac disease, it's just kind of, they feel better without it, which is fine. But there will be a small group of people, and it's quite important to pick up, because although you're giving yourself the right treatment and not having it, it can kind of have problems in the longer term. So what I would suggest we do is we do some initial blood tests, and then we include the celiac test, but we kind of take it with a bit of a pinch of salt, the result, because if you do have proper celiac disease, it will have other things probably showing up in the other blood tests, and it might be that we need to do some more investigations. But as a starting point, let's see. If you just speak to reception, I'll make you an appointment and get you sorted out for that. And then if you come and see me probably a few days after you've had the blood test done, then we can go through the results. Leave it kind of 3 or 4 days to get your test results back, and then we can see what shows from there.
Okay, brilliant. Thank you very much.
Thanks. Okay.
Really nice to meet you.
And you too. Bye.
Bye.
Right, I'm back, baby. Okay. Like I never left.
Have a seat. How are you?
I'm alright, thank you. Yeah, not too bad.
Okay, so this was follow-up from the last time.
Yeah.
Where I wasn't sure the problems that you were experiencing might or might not be asthma, and whether the inhaler was or wasn't going to help you, did it?
I've only had to use it a couple of times.
Yeah.
On those occasions it did help, yes.
Right, so what were the symptoms you had to use when you had to use it?
Shortness of breath. Basically, be walking along and suddenly, I'd be breathing perfectly normally, and then suddenly I'd just feel like someone had unplugged me.
What other symptoms did you have?
A bit of a tightness across the chest.
Right. Anything else?
No, it was just...
Okay,
well,
so you
actually, no, there was a bit of clamminess.
And then you used the inhaler, and how quickly did you feel better?
Within a couple of minutes.
Right. That's sort of literally that speed.
Yeah.
Okay, so basically, I don't think that was asthma.
Right.
Because it's just, those aren't symptoms of asthma really.
Okay.
Normally it's kind of over hours that it builds up, rather than just a few seconds. And actually the medication takes about 20 minutes to work.
Okay.
The symptoms that you're describing, I would say, are fairly typical symptoms of anxiety. Anxiety is one of the commonest things that we see in general practice. The common symptoms that we see are often to do with breathing, chest pain. Chest pain is obviously something that worries a lot of people because they think that it may be going to be a heart attack. And so chest pain is a common symptom of anxiety. And headaches are often related to anxiety, and people worry about brain tumours. But essentially, there is no bit of the body where you might not develop a symptom which could be, in fact, due to anxiety.
So it's a bit odd, isn't it? I'll be walking along normally and then suddenly it would happen.
Yes.
Why would I suddenly become anxious?
Okay, so that is odd. Are you an anxious person? Are you somebody who's prone?
My sister says I'm a worrywart.
Right, okay. Most people will think, okay, to get symptoms of anxiety, it will be kind of really logical.
So it could have been triggered by something.
Well, all I'm saying is you could just be your normal anxious self and suddenly get symptoms of extreme anxiety, because anxiety will sometimes do that, and it's for no reason. What you have to do is to stop being in your head worrying about feeling like this and thinking, what might it be? Maybe I'm going to die, because that tends to make you worse.
Okay. Right.
The way to handle anxiety is to try and just carry on regardless. So tell yourself, oh, that's just going to pass in a moment, I'll carry on. Historically, doctors did probably the worst thing in terms of anxiety because they gave people pills. Unfortunately, the pills for treating anxiety are highly addictive, so patients, once they start them, would find them almost impossible to stop. And so the therapy that we generally go for now for anxiety is called cognitive behavioural therapy, which is a very structured way of helping people to see what they are doing, which is actually winding them up.
At least now I know what it is, I won't worry
Okay.
about it.
Okay, fine. All right, because there are
It was just the breathing thing. Obviously, I thought if I stop breathing, then there's going to be a serious problem. So,
Yes,
so
yes.
it was the fact that I was struggling to get my breath.
Yeah. I don't think that was a real you couldn't breathe. That was a sensation that you couldn't breathe.
Okay, great. Thank you very much.
All right.
All right, cheers.
So as you see here, she did request it at 9:40 yesterday morning. So it should have been ready yesterday after 4.
Yeah. Okay.
So
Well, how did you get into that screen again? Oh, you just click on it.
To the medication
The one
list.
that showed like what she's requested.
Oh yeah, you right click
Yeah.
and then you press drug history.
Oh, okay.
And then you open that window.
Okay.
Erin speaking, how can I help?
Ah, hello, come through. Come and have a seat. So you're Catherine.
That's me.
My
We've
name's...
spoken on the phone a couple of times.
We have, that's right. It's nice to meet you.
Yes, and you.
Tell me more about what we can do for you today.
Yeah, so I obviously take quite a bit of medication for depression and anxiety, and I've had a couple of episodes. It's been pretty ongoing for about the last 6 or 7 years. And I think one of my last appointments here, where I was kind of in the midst of a crisis, was this time last year. And I just moved flats or moved houses, and I took a really bad knock. Literally just didn't get out of bed for weeks. And a year later, I just moved again. I bought a flat, so I've moved. I just kind of plummeted into a really kind of dark place. Whilst what I am taking now used to kind of combat difficult situations, and I could cope. I don't feel like it's combating. Like in the last year and a half, I'd say I've had 3 pretty deep kind of depression wobbles where I've been off work for a couple of weeks. And I guess I'm just concerned that I'm not managing it very well.
When you say that you have these fluctuations in mood, what's that like? So when your mood is elevated, what's that like?
People always say to me that you're very energetic, you know, so I can go out clubbing and I can dance for 18 hours straight, you know, and I can drink and I'm very excitable. I seem really happy. I almost feel like I do as much, I try and test my body to see how far I can push it in that kind of state.
Sometimes when people's mood is very high, they can actually run into problems, conflict with other people or spending money they don't have. Or does that ever happen?
No, I just become really over-energetic.
This period where you've moved and that's kind of made you feel very low, has it got so bad that you've wondered about harming yourself?
Now, do you think you could do a big wide mouth like a dinosaur or a lion for me?
And then, yeah, that's fine. Just have a look in it. Oh, well done. Well done. Oh, dear. There we go.
Okay. No pus on the tonsils. I think you should like a roar. Oh, good boy. Ah, now show your tongue. Oh, what a superstar.
It's more a numbness and just kind of like there's nothing you could say which would impact how I feel. I'm just completely frozen. Every morning I'm waking up automatically between around 5:30.
That waking up at 5:30, that's a very classic symptom of depression. Did you know that?
No.
Okay. So that's probably why that's happening.
Mm-hmm.
So it might be that when your depression is better treated, that stops happening and your sleep pattern is much better.
Mhm.
You could try a short course of sleeping tablets and see if that helps in the short term. Should we do that?
Mhm. And just a final thing, in terms of that kind of mood
Up and down.
variation, yeah, you know, is there a line between just kind of generally outgoing people with depression versus those that are bipolar? Are there any telltale signs?
So some of the questions asked you were looking for symptoms of mania. So people have lots of energy and confidence, but they also start to believe things that aren't true. So they believe that they're very powerful and they can achieve unrealistic things. But also they demonstrate other behaviours. So they might spend all of their money or be very promiscuous or that kind of thing. And that doesn't really sound like what you're describing.
Okay.
Does that seem all right?
Yep. Okay.
Okay?
Yeah.
All right.
Great. Thank you very much.
No problem. I'll see you again, but obviously you can give us a call if you need to before that.
Okay. Perfect. Thank you.
Bye-bye.
You didn't take in any of that, did you?
Not really.
There's too much information during the first week or so.
Oh my god.
And even if we're busy, just ask us and we'll tell you.
Hello. Good afternoon.
Time to finish my magazine.
Sorry about that. Come in, take a seat.
Do you receptionists tell you? Or, do you just know that I'm coming? You don't know why?
I have no idea, no.
All right.
It's a mystery every time.
Okay, good. My daughter's a doctor.
Yeah.
And she came around yesterday and I showed her this and she said, you've got shingles. It's right. But I noticed...
It's definitely shingles.
Well, you can tell.
Yeah, yeah.
Well, she took one look at it and said, it's shingles.
Definitely shingles, yeah.
Apparently it's all the same nerve.
Yeah. Is she a GP or...?
She's not. She's actually a hospital doctor.
Yeah.
But actually she's just given up being a doctor.
Is she?
And she's retrained to be a chef.
Absolutely brilliant.
And she's going to be a serious chef.
Yeah. I just at the moment, you know, so when you read all the things in general practice, so many people are just leaving. You know, what's the thought process at the moment? Well, let's just increase the opening of general practice, and we'll open 8 till 8 at the weekend, and it kind of misses the point in a way.
Yeah. I mean, it does make sense, but it shouldn't be that you guys work more hours, because I think you work lots of hours anyway.
Yeah.
It's just it needs to be spread over.
I've worked in practices outside of London, which are open on Saturday. Nobody comes. Nobody comes to those appointments.
I have read that.
Even here, quite often, those appointments people don't attend.
But people should be fined.
Yeah, the difficulty is the people that miss appointments on a regular basis are the people that, you know, really can't afford it.
And how long should they go? When will it go?
Go over the course of the next 4 or 5 days.
Okay, so it's quite quick.
Yeah.
Thanks very much.
Indeed. Take care. Have a nice weekend.
Yeah, it looks like they have arrived, so I'll get the doctor to have a look and give you a call back regarding the result.
Hello there, good morning.
Hello, Dad.
How are you?
Hi.
I've got Dr. Dillon with me today as well.
Nice to meet you.
A new doctor that's just joined us. So how are you keeping?
Oh, I'm all right.
Good?
Yeah. I had those tests down at the medical centre for the breathing.
Breathing tests?
Yeah.
Good, okay.
I used to go to the pensioners club down there, but it's full of old people, so I don't like
Do you know what? I don't have the results yet. They've not sent them through to me, unfortunately. Did they say anything to you at the time?
Give me one of them.
Ah, okay. Have you used this at all yet? No. Did she explain to you how to use it or when to use it? Yeah. And have you just felt that you've not needed it?
No, I never get out of breath.
I can watch you use it once now if you want, and we can check.
Well, it won't do me any harm.
It wouldn't do you any harm at all, no.
I've never used one, so...
Oh, there you go. We better check it.
It didn't go down, did it?
When you put it in your mouth, you need to put your lips on a tight seal round about it because you had your mouth open. And then take a really long, slow, deep breath. Okay, it's better. The thing you could improve on is taking a much deeper breath. So you kind of went, but you want to do a big breath into your lungs.
Yeah.
Yeah. And you're going to go back and see them at the hospital at some point about the stomach, aren't you?
Yes.
Yeah.
Yeah. Because they've got that cyst
yeah.
on the pancreas.
Yeah.
They're supposed to keep a check on if it enlarges at all.
Yeah.
You know, but I like to know how they know, because they never give me any x-rays for it.
So you've had you had a scan, didn't you? You had an MRI, which is better than an X-ray. It gives a better picture. You know the MRI scanner you went into? You had that.
Yeah.
There's a CT
And
scanner.
they asked me what music I'd like to listen to.
Yeah.
And I said, well, you've got Elvis Presley, Buddy Holly.
Look at you.
So they had to dig through their list and to find a CD of it.
But they found it for you.
Yeah.
Perfect.
Oh, I was all blind then.
Sounds like you had a great time.
Bye-bye.
All right. You take care. Bye. Bye.